Good evening, students. Today we will discuss about the front of arm and forearm. So, coming to the overview and anatomy summary, I have given in the notes. So, we are discussing about what upper limb, arm, forearm, and hand. So, we will today discuss only arm and forearm. So, arm, the front of arm, which all muscles are there? There are biceps brachii, coracobrachialis, and brachialis. And in the front of forearm, which all muscles are there? Flexor group of muscle, median and ulnar nerve, radial and ulnar arteries. So before that, in upper limb, arm is otherwise called as what? Brachium. In front of arm, the muscles are biceps brachii, coracobrachialis and brachialis. And the nerve supply is by musculocutaneous nerve that we will explain in detail. Main artery of arm is brachial artery, and main veins of arm are cephalic and basilic vein. And in back of arm, you have triceps brachii muscles, which I have given in notes. And forearm is otherwise called as antebrachium. And in front of forearm, there are three group of muscles: superficial group containing 4 muscles, intermediate group containing 1 muscle, and deep group containing 3 muscles. And the nerve supply of forearm are median and ulnar nerve, and blood supply of forearm are radial and ulnar arteries, and in back of forearm there is extensor muscle. So this is the overview. So upper limb, arm is otherwise called brachium. In front of arm, which muscles are there? Biceps brachii, coracobrachialis and brachialis. The nerve supply is by musculocutaneous nerve. Artery of arm is brachial artery. Vein of arm is cephalic and basilic vein. And in back of arm there is triceps brachii muscle. The forearm is otherwise called as antebrachium. In front of forearm, there are 3 group of muscle. Superficial group, which is 4 in number. In note there is a mistake, it is given as 5. Intermediate group, 1 muscle. Deep group, 3 muscle. Nerve supply is by median and ulnar nerve. Blood supply is by radial and ulnar arteries. And in back of forearm, there is extensor group of muscle. So this is what we are going to discuss today. Coming to the front of arm, what is the boundary of the arm? So boundary of the arm. So superior is at the level of deltoid insertion. So deltoid tuberosity, that area. Inferior boundary of the arm is cubital fossa. Medially there is medial intermuscular septum, and lateral there is lateral intermuscular septum. This is the boundaries of the arm. So I have given one picture. So see this one, these 2 lines I have given. So this portion is called as arm. Above this is shoulder, below this is forearm, then it will be hand. So like that. So I have given the picture of the muscles also. So here you can see deltoid muscle, you can see on the posterior side, triceps brachii, lateral head you can see, biceps brachii muscle you can see, brachialis muscle you can see. So just see that picture to get an understanding. So this is the cubital fossa. So what are the contents of cubital fossa? See, you can see biceps brachii muscles clearly I have marked in violet color. Brachial artery I have marked in red color, and see that yellow color thing is actually the lateral cutaneous nerve of forearm. So muscular cutaneous nerve actually enters lateral cutaneous nerve of forearm. That is what is shown there. And also you can see radial artery and ulnar artery in the picture. So we discussed about boundaries. So superior boundaries, what? Superior boundaries, level of deltoid insertion. Inferior boundaries, cubital fossa. Medial boundaries, medial intermuscular septum. Lateral boundaries, lateral intermuscular septum. So what is this intermuscular septum? It is a fibrous partition. It's a fibrous partition separating anterior compartment and posterior compartment of arm. Understood? So there are 2 compartments, anterior compartment and posterior compartment. Next, coming to the superficial structure, the skin is thin and mobile in the arm. In superficial fascia, there are 2 veins: cephalic vein, which is runs on lateral side of the arm, and basilic vein, which runs on the medial side of the arm. and there are cutaneous nerve. So this is in the superficial fascia. So mnemonic I have given one, cutaneous vein. So cutaneous veins carry blood vessels superficially. Coming to the deep fascia, it encloses the arm like a sleeve, and it also sends intermuscular septa and divides the arm into anterior and posterior compartments. So the deep fascia, the modification of deep fascia, that is the intermuscular septa, is the modification of deep fascia which divide the arm into two compartments, that is anterior compartment and posterior compartment. So next is the important thing, the muscles of the front of arm. So this you can study very easily. So I will explain that. So three muscles, that is biceps, brachialis and coracobrachialis. So you should study BBC muscle, biceps, brachialis and coracobrachialis. This you can study. So coming to the origin, the long head of biceps. So biceps means what? Two. There are two origins in the biceps. So long head is the supraglenoid tubercle. Supraglenoid tubercle is in the scapula, and short head in the coracoid process of scapula. So origin is in the scapula. There are two head, long head and short head. Long head is in the supraglenoid tubercle of scapula and short head in the coracoid process of scapula, and it inserts to radial tuberosity and bicipital aponeurosis. So it inserts to which all areas? Radial tuberosity and bicipital aponeurosis. What is bicipital aponeurosis? You can write that. From the tendon of biceps brachii, just about insertion of radial tuberosity, passes medially and downward superficial to brachial artery median nerve, merges with deep fascia of forearm on the medial side of forearm. So it is an aponeurosis from the tendon of biceps brachii. It is aponeurosis is a flattened tendon. So that's all. It's a modification. And what is the function? Function of biceps? It flex elbow and supinates forearm. So which are muscles in the front of arm? Three muscles, that is BBC muscle, biceps, brachialis and coracobrachialis. Biceps we have discussed the origin and insertion. And next is brachialis muscle. The origin is from the lower half of anterior humerus, and the inserts to coronary process of ulna. The nerve supply is musculocutaneous that we have to discuss, and brachialis is the main flexor of elbow. Brachialis is the main flexor of elbow. Next is coracobrachialis. Origin is in the coracoid process, inserts to the medial surface of humerus. Nerve supply is musculocutaneous nerves. What is the nerve root of musculocutaneous nerve? Which is C5, C7. It flexes and adducts the arm. Coracobrachialis flexes and adducts the arm at the shoulder. So that is the muscles of front of arm. Next, so coming to the nerve supply of arm, I already described, that is musculocutaneous nerve. So musculocutaneous nerve starts from the brachial plexus, that is from the lateral cord of the brachial plexus. It pierces the coracobrachialis muscles and run between biceps and brachialis. So this musculocutaneous nerve starts from the lateral cord of brachial plexus. It pierces coracobrachialis and runs between biceps and brachialis, and it ends as lateral cutaneous nerve of forearm. Understood? So mnemonic. So muscle, then first is pierces coracobrachialis, then between biceps and brachialis, then cutaneous to the skin. Next one. Next we will discuss about the arteries of the arm. So the artery is brachial artery. Brachial artery is the continuation of axillary artery. So brachial artery is the, so brachium is arm, isn't it? So brachial artery is the continuation of axillary artery. That only you should study. It begins at the lower border of teres major. So this brachial artery begins at the lower border of teres major and ends in cubital fossa. From the cubital fossa, it divides into radial and ulnar arteries. So that I have shown the picture. So this is the brachial artery. So when it comes to the cubital fossa, I will show you that. So this is the brachial artery. In the cubital fossa, it divides into radial and ulnar artery. Understood? Okay. So next one, coming to the branches of brachial artery, that is profunda brachial artery, superior ulnar collateral artery, inferior ulnar collateral artery, and muscular branches. What are the muscular branches of brachial artery? Are it supplies to biceps brachialis and coracobrachialis. Okay. Next, coming to the veins of arm. So cephalic vein, which courses to the lateral side and drains to the axillary vein. Basilic vein runs through the medial side and drains into the axillary vein. And there is a connection between the cephalic and basilic vein, that is called the median cubital vein, which is the common site of venipuncture. We take blood from that medial cubital vein because it is a fixed vein. So it is very easy to take. Understood? Next one, coming to the applied anatomy of arm. So if you take biceps jerk in the deep tendon reflexes, it goes to C5 C6 root. Brachial artery pulse you can take, which is medial to the biceps tendon. Muscular cutaneous nerve injury will cause weak flexion. Which flexion? Weak elbow flexion and sensory loss over lateral forearm. If there is a weak elbow flexion plus sensory loss of lateral forearm, it may be mostly due to muscular cutaneous nerve injury. So we have finished the arm. Now we are coming to the forearm. So I told it is divided into 3 groups: superficial 4, intermediate 1, and deep 3. It has a common origin. Origin you can study very easily because the origin is common, that is medial epicondyle. That is called the common flexor origin or common flexor tendon. So we can study the muscle. So first 4 you study: superficial group, intermediate group, and deep group. So superficial group 4 muscles are there. So all the front of the forearm muscles are flexors, generally flexors and pronators. Flexors and pronators. So there is pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. So these 4 you can study as pass fail, pass fail. So pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. Just study as pass fail, pass fail. So 4 muscles I think you have studied: pass fail, pass fail. So pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. So FDS is not there. That is in the intermediate group. Next, origin we have already studied. It is in the common origin, that is medial epicondyle. Just study that. Pronator teres has actually 2 head, that is humeral head is in the medial epicondyle and ulnar head is in the coronoid process. So I think you have understood that. Next, coming to the insertion. So pronator teres insert to the mid-lateral radius. So, and flexor carpi radialis insert to base of second and third metacarpal. Palmaris longus insert to palmar aponeurosis. And flexor carpi ulnaris insert to pisiform, hamate, and fifth metacarpal. Pisiform and hamate are wrist bones. So how to study this? So pronator teres, isn't it? Pronator, the name itself, there is pronator teres. So you should understand pronation is to the by radius, and radius is the lateral bone, isn't it? So how to study the insertion? Logically you should think the muscle is pronator teres. The name itself, there is pronation is there. So you understand that pronation is by radius and radius is the lateral bone. So insert to the mid lateral radius. Understood? Next is flexor carpi radialis. So radius is lateral bone and second and third metacarpal are also lateral. So base of second and third metacarpal. Palmaris longus. So palmaris palm is already there. So you can study insert to palmar aponeurosis. Next is flexic carpi ulnaris. So ulna is the medial bone. So insert to pisiform, hamate, and fifth metacarpal. So like this you can just understand that. So pronator teres, flexor carpi radialis, palmaris longus and flexor carpi ulnaris. Origin is all common. Insertion, logically you think and write that. So in these four muscles, the nerve supply is by all one nerve, generally one nerve, that is median nerve, except flexor carpi ulnaris. So except flexor carpi ulnaris, the nerve supply is by median nerve. So coming to the action, how to study the action. So pronated teres, in the name itself there is pronation. So action is pronation, and all the muscles of the front of the forearm are flexors. So pronated teres are pronation and weak flexion. Next is flexor carpi radialis. So it also flex because all the front of the forearm muscles flex. So it flexes and abducts wrist. So you just remember this, radial abducts. Radius always abducts. So radius always abduct. Understood. Next is palmaris longus. So already you know the muscles will flex. That is a common thing, and it is inserting to the palmar aponeurosis that we already discussed. So it tenses the palmar fascia. Next is flexor carpi ulnaris. It flexes and adducts. So you should remember ulna adducts, radius abducts. That's all. So like that you can remember this. Coming to the intermediate group, the intermediate group muscle is actually flexor digitorum superficialis or FDS. So here the origin is same, medial epicondyle, and it insert to the middle phalanges. So already the lateral and medial side we already discussed. Flexor carpi radialis insert to the base of second and third metacarpal, and flexor carpi ulnaris insert to pisiform hamate fifth metacarpal, and flexor digitorum superficialis, which is a intermediate group, insert to the middle phalanges. What is function? Digit already the name itself shows flexor digitorum superficialis. So it flexes the proximal interphalangeal joint and metacarpophalangeal joint. So that is the flexor digitorum superficialis. Next, coming to the deep group. Deep group you can study, that is flexor digitorum profundus, flexor pollicis longus, and pronator caudatus, PDF muscle. So flexor digitorum profundus, that is first P. Next is flexor pollicis longus. Sorry, so for P is flexor pollicis longus, D is flexor digitorum profundus, and then is pronator quadratus. PDF muscles like this you can study. So coming to the origin, so origin is in the ulna. So one is flexor digitorum profundus, origin is ulna and interosseous membrane. Flexor pollicis longus, origin is radius and interosseous membrane, and pronator quadratus, origin is ulna, and it inserts to flexor digitorum profundus, insert to distal phalanges. Flexor pollicis longus insert to base of distal phalanx of thumb, and pronator quadratus insert to distal 1/4 of radius. So the nerve supply, coming to the nerve supply, all nerves are median nerve. The nerve supply is by the median nerve, except FDP, except half of flexor digitorum profundus. All the muscles are from median nerve. The median nerve has actually divides into two. In that, the one branch of median nerve is called AIN. So that you can study. So that is anterior interosseous nerve. So that is a branch of median nerve that supplies the deep muscle of front of forearm. So and it is a purely motor nerve. And coming to the action, flexor digitorum profundus, action is it flexes distal interphalangeal joint. Flexor pollicis longus, it flexes the thumb. Pronator quadratus, it helps in pronation. So this is the deep muscles. So three layers: superficial layer, intermediate layer, and deep layer. Deep three muscles are flexor digitorum profundus, flexor pollicis longus, and pronator quadratus. So coming to the nerve supply summary I have given. So median nerve, all anterior forearm muscles except flexor carpi ulnaris by ulnar nerve and medial half of flexor digitorum profundus. So that is by medial half of flexor digitorum profundus is also by ulnar nerve. So ulnar nerve, FCU and medial half of FDP, and anterior introitious nerve, FPL, lateral half of FDP and pronator quadratus. So like this you can study this. Coming to the arterial supply, radial artery which originates from brachial artery supplies lateral forearm and hand. Ulnar artery also originates from brachial artery, supplies medial forearm and hand. So ulna is the middle bone, radius is the lateral bone. It's very easy. And common interosseous artery which origin from ulnar artery, and it divides into anterior and posterior branches. So that you just remember. So coming to the venous supply, the deep veins accompany the arteries, which is venae comitans, and superficial vein are cephalic vein, basilic vein, and median antebrachial vein. Next, coming to the applied anatomy, golfer's elbow, you all know that is medial epicondylitis, inflammation of the medial tendon, the common medial origin, that is medial epicondylitis. Pronator syndrome is actually the compression of median nerve between head of pronator teres muscle. Ulnar nerve injury in the cubital tunnel will cause claw hand deformity. And anterior interosseous syndrome, it's a branch of median nerve that we already discussed. The patient cannot make the OK sign, so OK sign cannot be made. Next, coming to the surface anatomy, medial brachial artery is medial to the biceps tendon. Median cubital vein, already we discussed, it is in front of elbow. Radial artery pulse, it is lateral to the flexi carpi radialis at wrist. And ulnar artery pulse, you can palpate it lateral to the flexor carpi ulnaris at the wrist. So arterial pathway, how I have already discussed how the arterial pathway comes. The main is axillary artery, from axillary artery to brachial artery. Then it divides into radial artery and ulnar artery. Radial artery supplies lateral forearm and deep palmar arch, and ulnar artery supplies medial forearm and superficial palmar arch. So these diagrams you can study. Next, some clinical correlations. If biceps muscle or tendon is ruptured, it causes a deformity called as Popeye deformity. Median nerve injury at elbow will cause hand of benediction. Benediction means blessing. So the patient is unable to flex index and middle fingers at MCP or metacarpophalangeal or proximal interphalangeal joint. Ulnar nerve injury will already be discussed. It will cause claw hand. Radial artery cannulation, generally for ABG, arterial blood gas, radial artery cannulation is taught. So front of arm, 3 muscles, BBC, we already discussed that. Next, all supplied by which nerve? Muscular cutaneous nerve. Front of forearm, 8 muscle, 4 plus 1 plus 3. So next is chief action is the front of forearm, flexion and pronation. Major nerves, what are the major nerves? Median nerve and ulnar nerve. And major artery, radial and ulnar artery from brachial artery. So by this we have finished the chapter. So thank you.